Now to a first-of-a-kind study about the cost of the obesity epidemic in this country. Researchers found more than 30% of American adults last year were obese, costing the healthcare system nearly $80 billion. And over the next decade, the study projects the obesity rate will jump to 43%, costing $344 billion, or one-fifth of total healthcare spending. More on this story now from our national correspondent, Jeff Glor.
The study says obesity is growing faster than any other public health problem in U.S. history.
Obesity and chronic disease is the leading driver of rising healthcare costs. So it is the biggest challenge that we face.
An epidemic that is not only expanding our waistlines, but our national budget. The $344 billion projection on obesity costs would amount to 21% of all money spent on healthcare by 2018. That is up from 9% we spend today. An obese person would spend an average of more than $8,000 a year on medical bills, up nearly $2,500.
Finally, in one package, we see what it's really going to cost.
Since 1985, obesity levels have doubled in this country. Dr. Louis Aroni says this is the first time we're seeing the size of the bills.
We now are seeing a veritable tsunami of healthcare costs, all driven by obesity and its complications, diabetes, heart disease, cancer, and the more than 50 other illnesses.
A person is considered obese if they're at least 30 pounds overweight. The report offers startling state-by-state projections. Within 10 years, 6 states will have populations where more than half of adults are obese. Only one state, Colorado, will have an obesity rate under 30%.
It's a wake-up call. We need to find better solutions here and ways to engage people on diet, exercise, and nutrition. If we don't, we're not going to be able to control the growth in healthcare spending.
The study says that if the obesity rate stays at the current level, which is already high, Katie, the country would save $200 billion a year by 2018.
And Jeff, most of us know this, but just to review, why are Americans becoming so obese?
Well, I mean, bigger portions is one thing, more processed foods, less exercise, but it's one thing to diagnose this problem, another to cure it. So far, that has not happened yet.
All right, Jeff Glor. Jeff, thanks very much.